Very good morning to you, and of course we're continuing with our live coverage of it here at the ICC, the 6th Multilateral Initiative on Malaria Conference. Yes, indeed, again, a very exciting day. Plenary sessions are continuing today. Earlier this morning we were discussing drug resistance and its impact on malaria. And now I have the pleasure of being joined by Professor Lucille Blumberg from the Institute of Communicable Diseases in South Africa. Professor Blumberg is also the chairperson of the South African Malaria Elimination Committee. Later this afternoon, South Africa, of course, will be releasing a new report on the rollback malaria progress and impact series. Our country has made significant strides in reducing malaria, controlling malaria. Statistics show that from 2000 to 2011, we saw the number of cases of malaria decreasing by around 85%. We also saw our death rates decreasing by 81%. I have the pleasure, of course, of being joined by Professor Lucille Blumberg to discuss the report. Professor Blumberg, thank you very much for joining us. What are the cornerstones of the South African malaria program?
We have a really very long-standing, well-established program, and it's focused on prevention of mosquito bites through spraying of households inside with long-acting insecticides to reduce mosquitoes. And we also, it's been on effective treatment based on a confirmed diagnosis, health promotion in the community, and very intense monitoring for resistance parasites, resistance mosquitoes, and a very dedicated program.
What have been the key defining characteristics of the South African malaria control program?
I think firstly in the huge political commitment, dedicated funding, and a dedicated malaria program. And secondly, I think we are a little bit different to the rest of Africa. Our intensity of transmission is much lower.
And the importance of our cross-border initiatives?
I think you raise a very important point. Much of our malaria, particularly now and in 2000 where we had major problems, has been imported malaria, particularly from Mozambique. So cross-border initiatives are absolutely critical.
And can you tell us about some of those initiatives that have been put in place, Professor?
Well, in 2000, when we had the major increase in malaria, a very specific program was set up, the Lubombo Spatial Initiative, which through funding and a lot of resources, provided very similar indoor residual spraying and treatment to people in various countries in the southern African region.
South Africa has set itself a goal. By 2018, we hope to eliminate malaria. And how do we aim to do that? And are we on track to achieving that goal?
Well, we're on track. We're in the pre-elimination phase. I think the next step is a very difficult one. And elimination means that we will have no local transmission, but we still have the mosquitoes, and so imported cases will certainly still be an issue. But we're going to have to change our game. We need sustained funding, and you can be a victim of your success. As your numbers go down, you can lose those resources. We'll have to do intensive monitoring for resistance, for drugs, and we'll have to follow up each case and in the community and break the transmission chain.
I know earlier on, Professor, we were speaking about the importance of the conference, not only to our country, our continent, and of course globally, and how pleased you were to have the conference being hosted in South Africa. Then it would be to the contribution. What is South Africa's contribution to international malaria research?
Well, I think there are many, but perhaps two that stand out. We have Professor Kelly Jabali from Cape Town, who's been instrumental in the identification and development of a potential new malaria drug, and that's very exciting. And then I think we've been pioneers in this spraying of households and have really led the world on that initiative.
And just lastly, the progress report that you'll be delivering later on today. Just tell us about that as well, please, Professor.
It's an initiative from Rollback Malaria Program with WHO, and it's the Progress and Impact series, and it chronicles really a remarkable journey of South Africa towards elimination. It allows you to take stock of where you are and what you plan to do. So I think we look forward to presenting that.
Well, thank you very much, Professor. That was Professor Lucille Blumberg from the South African Institute of Communicable Disease. And we're looking forward, of course, to that report that will be presented later in this afternoon. We're also expecting the Minister of Health, Dr. Aaron Motsoaledi, to attend the conference later in the afternoon. But of course, as soon as that report is delivered, we'll be bringing you more information that will be coming up. There are other plenary sessions that are going ahead, and of course, we will also be giving you all the latest information coming out of those plenary discussions. At the moment, that is all that we have from you in Durban. Let me take it back to you in the studio.